This conference will now be recorded.
Okay. And my employment is sponsored by Ascendium Education Group, which means they're paying my salary to do this work. I think it's awesome that we have local businesses and community that really make that kind of commitment to help these fall campaigns. So I think that's what helps make this just work so well. I want to thank you for your past generous contributions. And if you are thinking about being a first-time donor, welcome. Because this year, when the need is greater than ever, we're just looking for participation. Whatever amount is meaningful to you is going to be meaningful to the recipients. And so I really hope you will consider going to ePledge or using one of the other pledging options available to make a donation to Partners in Giving this year. Partners in Giving since 1973 has raised over $81 million, which is one of the most successful statewide campaigns in the nation. And we do it with a low overhead of 4%. And how can we do that? We can do that because of the generous time given by your chairs and the other volunteers that have stepped up to help with this campaign. With over 500 charities in our booklet, there has to be something for everyone, I believe. And so today we're going to hear from a couple of those, and I'm excited. So our first speaker today is Chelsea Tibbetts, and she is going to speak on behalf of the Wisconsin Women's Health Foundation. That group really provides services in just what it says, women's health. They use evidence-based procedures or plans for disease prevention and their research initiatives on the conditions that most affect women. And we know that women's health is different. The chronic conditions that affect women are different than men. So this is a really, really necessary area of focus. And it is one of the charities under the umbrella organization, Community Health and Charities. So that's where you can find them. And again, I want to thank Chelsea for coming to speak with us today.
Thank you, Jody. I am so honored to be here and just so happy to have the chance to share with everyone today. So I believe Carly's going to help me. I am going to try and share my screen so that I can give you guys some visual. And in doing that, I'm also going to stop sharing my webcam. I've just had some experience in the past where sometimes the tech is better when I am not sharing both at the same time. So I'm going to stop showing my webcam and hopefully start showing my screen for you guys. All right. Now, just with a head nod, is that showing up for everyone? Perfect. Okay. So again, I just want to say thank you for inviting me to speak today. My name is Chelsea Tibbetts. I am the Outreach Manager at the Wisconsin Women's Health Foundation. And I'm really excited to be here to share some information about our work and as a Community Health Charities partner, just how grateful we are for the opportunity. So the Wisconsin Women's Health Foundation is a 501c3 nonprofit organization founded in 1997. We provide free women's health education and support programs for women and their families, all of which fulfill our mission to innovate, impact, and improve women's health. Our programs are free and are accessible to anyone who needs assistance, serving all 72 counties of Wisconsin and between 7,000 and 8,000 individuals each year. Through our First Breath program, we're supporting a mom in her quit smoking journey, ultimately resulting in healthier babies and families. This statewide program helps pregnant women, new moms, and their families become smoke-free. Because in Wisconsin, 1 in 10 women use tobacco during pregnancy, which is higher than the national average. This past year, over 1,650 pregnant and postpartum women were referred to our cessation services to receive individualized counseling with a First Breath Quit Coach. So our Quit Coaches are certified tobacco treatment specialists, and they're employees of the Wisconsin Women's Health Foundation. They live and work in the community served, and they provide intensive one-on-one support to women and families throughout their entire pregnancy and up to 6 months postpartum. This shows the 6 Quit Coaches and the different areas that they cover throughout all 72 counties in the state. And as you can imagine, when our Quit Coaches are addressing smoking and nicotine addiction with their participants, a number of other stressors, concerns, and needs come up as well, especially during a time like now. Our Quit Coaches' education and their backgrounds vary in areas such as social work, certified lactation consulting, substance use dependence, family therapy, and so much more. And in addition to their academic degrees and education, each Quit Coach has received intensive training in maternal and child health tobacco cessation. They are experts in their field. There's no one else like them throughout the state, and they're equipped to address all areas of care to best support their clients' success. This includes building and increasing self-efficacy, confidence, and motivation, developing stress management, coping, and communication and negotiation skills, and setting and working towards short and long-term goals to set them up for success for life. Pregnant women and new moms up to 6 months postpartum receive the most intensive services through First Breath. This is done intentionally, as we want to address the immediate risk for mom and baby throughout the prenatal and postpartum period. These intensive services include monthly check-ins with their Quit Coaches from pregnancy through 6 months postpartum, and they can receive up to $140 in gift cards to celebrate their success and their participation. Support people such as partners, grandparents, and caregivers still receive assistance as well. It's just not quite as intense. And this allows our services to focus on mom and baby while still integrating support from her loved ones. So how well does First Breath work? We are very proud to report that 75% of those enrolled achieve a smoke-free home following participation in First Breath. This means that families and children aren't exposed to second and third-hand smoke, causing a number of different illnesses and diseases from short-term to lifelong. And while First Breath is currently focused on assisting women and families with nicotine addiction, we are actively developing and piloting a program to address all substance use during pregnancy. And we hope to launch this as a formal program as soon as funding has been secured. Another program I want to speak about is Grapevine. Our Grapevine program works with women across the lifespan to learn how to make lifestyle changes to prevent and address women's health issues and disease. Grapevine trains nurses to lead health education sessions in their Wisconsin communities. Each year, 100 volunteer nurses reach over 2,000 women across the state with women's health topics, including breast and gynecologic cancer, cardiovascular disease, mental health, self-care, brain health, bone health, diabetes, and many more areas, which you can see listed here. We currently have 14 health topics available and 2 new units coming soon, including nutrition and sleep. Individuals who are interested in receiving health education from a Grapevine nurse can request one of our health topic sessions to be presented in their community. And while typically these sessions are held in person, we are currently offering our education virtually. This ensures that we're doing our part to keep everyone safe, including our volunteer nurses, our session participants, and the community as a whole. Sessions may be requested through our Wisconsin Women's Health Foundation website, and of course, they are free of charge. Nurses who present these sessions are volunteers of the Grapevine program. They are giving us our time and generously their education. These individuals receive evidence-based training on our different health topics and have the chance to share this information with groups of women throughout their communities. Some sessions are small, providing a more intimate experience, while others are presented as part of a much larger event, such as a conference or a webinar series. But regardless of size or venue, our goal as an organization remains the same: reach women with real evidence-based information and resources to assist them in living a healthy lifestyle and preventing disease. Our latest addition at the Wisconsin Women's Health Foundation is the Well Badger Resource Center. Well Badger provides women and families with health information and referral to services. We receive calls from families all over the state who are looking for resources for a variety of reasons and needs. And as you can imagine, this need has increased significantly given the current pandemic and other public health crises. Before we get into the details of the program, I want to set the stage by explaining what we are aiming to achieve through Well Badger. These are our three main focus areas. First, we want to increase utilization of services. We listen to families, we hear their story first. Then we match them with services that are appropriate based on their need, where they live, and what the priority is. The goal is to connect people to services. Some people don't know these programs exist. They don't know if they qualify, and our goal is to increase utilization. Next, we're committed to improving health literacy. When people contact us, they are overwhelmed, they are confused, they don't know where to start. And we break things down for them so that they can understand the services and then clarify next steps. And finally, the foundation of this program is to advance health equity. We work day in and day out to reduce health disparities by addressing the root causes, making sure individuals' basic needs are met, and that we're breaking down barriers to care. So when individuals contact us, we are asking about additional needs. And when we're identifying any barriers, we work to come up with creative solutions to break them down. Well Badger provides information and referral services in two ways. The first is through our certified resource specialists. Our staff are actively fielding questions weekdays from 7 a.m. to 6 p.m. And these questions are coming in through phone, text message, email, Facebook Messenger, and live chat online. 75% of our cases are an individual calling for resources for themselves and their family, and 25% are someone calling on behalf of the individual needing those services. This includes family members as well as other agencies and professionals looking for help on behalf of a patient or a client. Well Badger information and referral specialists assist in a variety of ways. We recognize that first and foremost, the clients who are contacting us just need someone to listen. From there, the Well Badger staff will conduct some eligibility screening, provide education on available services, and work with the individual to identify needs and access to care. In all interactions, Well Badger staff proactively connects and collaborates with other INR programs. The state of Wisconsin is very fortunate that it has multiple INR options, and we work closely with other agencies, including 211 and the Children and Youth with Special Health Care Needs Regional Centers. Our agencies all promote the concept of no wrong door. If someone contacts us, we will help them. Right now, our staff are averaging about 2.7 referrals per case, and this number continues to increase. What we're finding is that individuals need help on a number of different issues during one call. To give you a more concrete example of what we do through Well Badger, I wanted to share a list of questions that we frequently receive from participants. The type of cases that we help with really run the gamut. We help with finding mental health services, financial services, WIC, health insurance, Katie Beckett, CLTS, and so much more. Some of the calls that we take are pretty straightforward, like somebody wanting to know the phone number for their local WIC office, whereas others, and most of the calls that we receive, are much more nuanced. They require multi-step problem solving to get the family the resources and the help they need, and we are happy to do that. I mentioned there's two ways that individuals can access Well Badger. And the first is through that certified resource specialist who will help one-on-one. However, if someone prefers to look for resources independently, they can also access the Well Badger Resource Center using our online directory at wellbadger.org, where they can search from over 4,000 local and verified health services. And we've organized these resources into 6 main topic areas listed here on the right. To finish up my time with you all today, I want to close with who we're helping through this program. Well Badger services focus on pregnant and postpartum individuals, children and youth with special health care needs, and low-income individuals and families. About 80% of our cases are by phone and 20% electronic information and referral. I talked about how the INR staff help individuals prioritize their needs, and that oftentimes we make multiple referrals to address a variety of concerns. For this reason, you will see that while we help about 1,750 individuals throughout the year, we'll make approximately 3,740 referrals within that same time span. And follow-up is key to Well Badger services. We need to ensure that people are getting connected. And if they're not getting connected, we identify barriers. We troubleshoot new ways to get them the help that they need. Many folks are benefiting from ongoing support and access to resources through long-term electronic follow-up, both email and text, which we are now providing through a new launch of a program called Well Badger Link. In a nutshell, the Wisconsin Women's Health Foundation is meeting the needs of women and families across the state, working both locally and statewide. I want to thank you for the opportunity to share about our work, and I welcome any questions at this time as well.
Thank you, Chelsea. I think we're going to go on to the next speaker, and then we're going to take general questions at the end, if that's all right.
That is perfect. Thank you so much, Jody.
Okay, thank you. That was really interesting. I appreciate that. So our next speaker is Darren Blankenship, who is the Midwest Regional Manager for EarthShare. EarthShare has been around for 30 years, and it has a network of more than 500 member organizations that bring together individuals, workplaces, and communities to help in its mission to protect our planet. And I can't think of our planet's health, actually, and I can't think of a mission that is more important, really. So I really appreciate Darren being here. In Wisconsin, EarthShare includes 34 organizations, which are listed in the Partners in Giving booklet. So many options to donate to this wonderful cause. Take it away, Darren.
Thank you, Jody. Can everyone hear me okay?
Yes.
Okay, I'm gonna go the route that Chelsea did too. I think it may be more successful. I'm gonna try to share my screen here, but not my face at the same time.
Darren, it looks like real estate wise, if you did turn on your camera, it wouldn't make any difference real estate wise.
Can you guys see my screen?
Yes.
The first slide? Okay. Well, I appreciate that introduction, Jody. I am the Midwest Regional Manager for EarthShare, and we are one of the 11 umbrella organizations participating in the Partners in Giving campaign. So, you know, EarthShare is all about natural resource protection, the air we breathe, the water we drink, and the land that grows our food. So a gift to EarthShare Wisconsin enables you to do things like plant trees, preserve land for your favorite parks and trails, ensure that your favorite lakes and streams remain clean, protect our most endangered wildlife, and improve the public health for your family and others. Today, I'm going to share some brief success stories from a few of our member charities and how those donations can help our member charities to continue to thrive. And I also just want to back up and say to all of you on the call, if you're a volunteer, chair, coordinator, thank you very much for helping facilitate the campaign. Charities like EarthShare and the Wisconsin Women's Health Foundation cannot raise the money that we do without volunteers like you helping with the campaign. And for all of you on the call who have given to the Past the Partners Giving campaign, thank you as well. Now, the first member I'd like to highlight is the Ice Age Trail Alliance. The Ice Age National Scenic Trail is one of only 11 national scenic trails in the United States, kind of a well-kept secret with somewhat in our state. This organization, the Ice Age Trail Alliance, helps to build, maintain, protect, and promote this statewide treasure. We have many hikeable segments in and around Dane County. They also offer this Saunters program, as you're seeing on the slide there. The organization works with teachers across the state to take kids out on different parts of the trail and provide environmental education. They also do classroom presentations prior to taking the kids out on the trail. And that program continues to grow and has been very popular. Another one of our members is the Groundswell Conservancy. They are a land trust based here in Madison and work in South Central Wisconsin and regions outside of that as well. They have protected some key parcels of land in and around Dane County. Some of the places they help protect are Black Earth Creek watershed west of Madison, Patrick Marsh near Sun Prairie, the town of Dunn southeast of Madison, and Westport Drumlins near Wanakee. They have been very successful. They protected more than 10,000 acres of land here in South Central Wisconsin. And they and the Ice Age Trail Alliance have plenty of volunteer opportunities to get out on the trails and help maintain the trails and cut down invasive species if you like to work outside. And they can provide social distancing guidelines as well, both organizations, if you're looking for something to do outside. Another one of our members is the Alliance for the Great Lakes. On the slide there, I mentioned Lake Michigan, but also part of Wisconsin also touches Lake Superior. They do a lot of policy work in the Midwest, protecting our great resource, the Great Lakes. They have a very successful program, Adopt a Beach program, all along the different lake shores. So that is another volunteer opportunity if you're in those areas. Particularly, they have a lot of volunteers in the Milwaukee area. I know there are some people that go in that direction to volunteer as well. So that, as you can see, I've been sharing also some how much each pay period, how much a donation would make in those pay periods to help these member charities. And again, that some of the dollars would go to help sponsor some of those cleanups. Another one of our members, a very popular member, is the Nature Conservancy. They have protected some key landscapes in Wisconsin, including the Military Ridge Prairie area, the Baraboo Hills, and Door County. This land includes forests, wetlands, rivers, and lakes, help preserve a wide array of native plants and wildlife. And this organization also works worldwide to save and protect our special places around the world. They have been really successful in Wisconsin as well, protecting more than 160,000 acres of different types of land types. And one of our most popular members is the World Wildlife Fund. You may have heard last winter there was some terrible fires in Australia last January and maybe even outside of that month, where there's a lot of the koala bear population unfortunately was affected as well, and they are still working in that area to try to help restore the koala bear population. This organization has been very successful working, as their name entails, around the world, protecting endangered species in more than 100 countries. So you can also adopt an animal, theoretically, and help protect their habitat as well. And that program is very, very popular with World Wildlife Funds. So for EarthShare Wisconsin, as one of the umbrella organizations, you can make a gift to the environment to EarthShare Wisconsin, and it's going to be shared among our member groups. And of course, some donors like to pick and choose some of our members as well. and make specific donations, and you can do that as well. We really feel that a gift to EarthShare Wisconsin and our member charities will protect the environment not only now, but benefit of future generations. You know, that includes our children, grandchildren, nieces, and nephews. I've got our website there if you'd like more information. Also happy to answer questions directly as well. And I want to thank you for your time today and considering a donation to EarthShare Wisconsin and any of our member charities or any other charities in the Partners in Giving campaign. I appreciate your past donations and volunteer time, and thank you again.
Thank you, Darren. That was interesting. I know a lot of those organizations are really important to keep our planet healthy. Does anybody have any questions for Chelsea or Darren? Any of the people out there? Don't see anybody raising their hand. Well, thank you all who joined us, and I hope that you found this inspiring and will really think about not just these organizations, but all the organizations in the booklet in terms of giving. And please take the time to go and pledge. I think as Darren showed, it doesn't take much. $1 a paycheck can do so much for any of the organizations in the booklet. And so please join us. Together we are stronger. Thank you so much.
Thank you.
Thank you, everyone, and thank you, Darren.
Bye.